Welcome.
Imagine you're in a doctor's office's waiting room.
Sometimes it can feel like you're just withering away.
This is
Healthcare.
What do we say to poor health? Not
today.
Hello. We are unmet medical needs of the Native American population. My name is Daren Pierre.
And I'm Erica Adkins.
When first considering the medical needs of Native Americans, we want to first look at their history. To sufficiently examine and ultimately address health disparities affecting Native Americans, it is essential that we need to understand their unique historical and legal context. As the United States expanded westward, Native Americans were forced to move to reservations, and the federal government made efforts to assimilate Native Americans into mainstream society. As tribes resettled, they continued to suffer from infectious diseases that plagued the population during the prior decades of warfare. Over time, this would lead to historical trauma, which has had a tremendous effect on the Native American identity of self, family, and communities today. Today, the health status of American Indians is below that of the general U.S. population and has been for many years. Interestingly enough, many tribes value the concept of wellness, and it is at the core of their health beliefs. Continuing on the cultural lens, studies have found that Native American identity influences medical communication and may be associated with lower satisfaction with medical interactions. These dimensions of cultural identity seem to be linked to views of historic abuses by healthcare institutions, where memories of such abuses contributed to lower institutional trust.
Native Americans are disproportionately affected by a number of different diseases and health issues. Alcoholism and destructive drinking patterns are serious social concerns. The opioid epidemic is a huge problem currently in the United States, but opioid overdose mortality rates have grown over the last 17 years for Native Americans. Poor mental health is also a big concern, with there being a disproportionate burden of suicide and related behavior. There is also unequal access to healthy foods in rural and reservation communities, which creates food deserts and can lead to problems like cardiovascular issues and diabetes.
What contributes to these common health issues experienced in the Native American population is seen in social and demographic structures. The tendency of some Native Americans to live in more rural areas leads to less access to hospitals, health clinics, or positive nutritional choices, which has overall led to poor health outcomes. In education, possession of a high school diploma or GED is significantly lower than that of other racial groups and worsens when considering a college degree. In employment, Native Americans tend to have a lower labor workforce participation than the general population. These discrepancies have a significant impact on the quality of life experienced by this population.
There is also some demographic variables surrounding unmet needs of Native Americans. The elder population is growing, and it has been found that elders consistently share discourses of doubt, fear, and uncertainty when it comes to receiving health care. There's also a poor history regarding Native American women and healthcare rights in the United States, and there are continuing health inequalities between American Indian women and the general United States population. Women have health concerns about being ignored at the doctor's office or overlooked, a lack of consistent and qualified providers, suboptimal patient-provider relationship, and they often feel pressure to be treated and misinformation about treatment. All of this contributes to negative health beliefs because of perceived distrust. Now moving on to what is currently being done to support Native American health issues. The National Institute of Health recognizes the challenges and unmet needs Native Americans are facing, and the National Institute of Health is working with tribal and community leaders to conduct research and make culturally informed decisions regarding healthcare. There have also been advancements in telehealth, which emphasizes relationships and communication while facilitating improved healthcare quality, cost effectiveness, and value. The Indian Health Services has also adopted an electronic health record system, which improves communication between providers and can create more trust amongst patients and providers, since all their information will be kept on file even if the physician changes. The Affordable Care Act also included important provisions for Native Americans, where if they so choose, they could keep the insurance they have under the Indian Health Services, or they could have the option to enroll all year round in the marketplace with possible reduced cost sharing.
Moving forward, in order to completely address these unmet medical needs of Native Americans, we also need to consider recommendations. And there are several of them. These recommendations look at first telehealth, which, as we touched on earlier, is also important when considering making healthcare accessible to the rural population of Native Americans. Additionally, it is important that we break the cycle of mistrust, which can be achieved by learning, validating, and respecting the Native Americans community's history. This can also be further achieved by increasing culturally responsive care and mental health through the push of the growth of culturally competent providers in the United States. In the end, our overarching goal needs to be achieving that wellness that is so desired by the Native American population. To conclude, Native Americans have been disproportionately affected because of historical trauma they experience, social and demographic structures, and differing healthcare issues.
Through the varying recommendations and supports we included in this presentation, we can hopefully change the trajectory of Native American health. And for our discussion questions, we have: to what extent can the government provide better services besides the Affordable Care Act to help achieve better health outcomes for Native Americans? And also, considering the variables negatively affecting Native American health, how do you think that the community was impacted by COVID-19?
Thank you so much, and we hope that you found our presentation insightful and got to learn more about the healthcare issues surrounding the Native American population. And here are our references. Thank you.